It's a little intimidating. The physician we're about to talk to, Ezioma Gbujie, is an individual that is an expert when it comes to kratom. Now, I don't think it's fair to her not say a little bit about this. She's an MD, an MVH, MBA. She's board certified internist and addiction medicine specialist. We can go on and on and on. The truth of the matter is she knows what she's doing. When it comes to kratom, she understands it. Dr. Ezioma, good to have you on News and Views, Doctor.
Thank you so much for having me.
If we can, describe to people what kratom is.
So in layman's terms, I would say that it's a plant that is actually indigenous to the Asia, like Indonesia regions. The leaves have been used for centuries for both medicinal and religious reasons. It's in low doses, so the people who use it in those places, they basically pluck it and chew it because in very low doses, it is a stimulant. It's related to cocoa leaves, that has caffeine. And as we know, caffeine is a mild stimulant. But in higher doses, it's actually an opioid. And many people actually use it instrumentally. Basically, they want to elevate their mood because it does work on those receptors in the lower doses, the stimulant property. Energy boosting, most people say, okay, it gives me energy. But in higher doses, it's actually... it's a partial opioid, like I would say, buprenorphine, which we actually use to treat opioid use disorder. So that's kratom in a nutshell. And, commercially these days, it comes as dried leaves, tea, capsules, tinctures, and it's getting more and more concentrated.
So in high dosage, we're talking about it being more addictive, or
because it's a partial opioid in its pure form, the higher doses of it. So yes, it does have abuse potential and dependency.
What about in higher dosage, the opportunity for it to take life, for somebody to OD, for lack of a better way of putting it, with it?
Correct. That's a great question. In higher doses, the pure form of kratom actually does, because it's a partial receptor. So the pure form would most likely not do that. But its commercial form these days, they take another alkaloid in that plant and just concentrate it. And some people take it to labs and add other properties, basically change the chemical structure. And in those newer forms, it actually could cause overdose and death.
So what I just heard you say was, in those forms, is another way of saying synthetic?
Correct. So there is like a flow chart, I would say. So if you get that plant, the two major alkaloids that have these properties we're talking about are mitragynine, I'm going to call the chemical name, and the 7-hydroxymitragynine. So these two are the active components in that plant. Now, the 7-OH is a little more potent, but in the natural plants, it's just trace. So it would do the same things, but again, it in that quantity is not dangerous. But what people do is that you can actually, from the basic mitragynine, synthesize more of 7-OH. So the more is synthesized, the more is processed, the more the chemical structure is rearranged, then the more dependence, abuse, then the more it becomes a full opioid that can now cause overdoses and death.
Okay. You compared it earlier on. I shouldn't say you compared it to coffee, but you made a reference to coffee in terms of being a stimulant. I know people that are addicted to coffee that want stronger coffee, and they want stronger coffee for the very reasons you just described. Compare it to that in the sense of normal usage of kratom.
So I would give an arbitrary low dose of kratom, like 1 to 3 grams. That would be considered low dose, but the higher doses are greater than 4, right? Most cups of coffee would contain about 200 to, actually, they say 170 to about 500 milligrams of caffeine. So in the lower doses, and I should say that I'm not trying to say that that kratom is equal to coffee. It's not. Again, because I think it's a little more potent. Caffeine does not work on the opioid receptor, for instance. Yeah. It does not in any quantity. It works more on the adenosine receptors. Now, this kratom would work on like 5 different receptors that are, I would call it neurostimulating, right? You would have the adrenergic, serotonergic, opioid, dopamine. So it's a much more potent substance. I wouldn't say that is in any way as mild as coffee, but it's related, like the plant is related to that family.
Okay. And that was a road I'm not sure I should have taken you down.
It's fine.
What I was trying to do is make it relative to people that never knew about it or maybe never used it. And so when you said coffee, it kind of jumped out at me. The individual that I spoke to that takes kratom or uses kratom, uses it for pain relief. Do you see that a lot?
Yes. I would actually say that the first patient the first time I heard about kratom was a patient here in Fargo. He was in the hospital and actually very itchy to go because he had chronic back pain and was using kratom, and we were not attending, obviously, to that need. So he was in some withdrawal. And then I asked, what do you use for your pain? He's like, kratom. I was like, what is that? This was like 4 years ago. I didn't even know about it. So he tells me, I just buy it, from the gas station and use it. It really works great for my pain. And, I have a high tolerance for pain meds because of it. And you're not treating my pain to the degree that kratom will work for me.
Is there some type of study or evidence that kratom on a certain percentage or that it's caused a lot of addiction? There's all types of studies out there of what cocaine has done, what, alcohol has done, is there anything out there in relation to, in the medical field, kratom?
We do have, it's definitely not as developed. Like my boss in Massachusetts, he just released a paper. Most of the paper studies are really just like cross-sectional, like seeing that the use is increasing. We don't have that much data on the studies, but we do know that from like a population standpoint, there is definitely an uptake in the number of people who are using it.
Should kratom be used in any way other than prescribed?
So that's a great question because there is no what we call currently accepted medical use for kratom, which is why the original push is for it to be a Schedule 1 substance, meaning that there is no currently accepted medical use. It does have abuse potential. It can cause dependence.
Okay, so what we have right now, I can go down to the convenience store here and buy kratom. I can go to the gas station and buy kratom. We have people who have been doing that. We have people who rely on it for pain relief that now are sitting there asking the question, I'm not addicted to it. I've used it. Why in the world are they making it illegal? And your advice to those individuals who are mad that they might lose that opportunity is?
There are other regulated, safer options, because up until now, this substance has been unregulated. So the labels and the contents most likely do not match. And that is the danger in using this kind of substances.
So you look at things on a way broader picture on a nationwide scale. North Dakota is holding a special session in order to deal with it. How are other states already dealing with it?
So before North Dakota, there were 8 states that actually already have a complete ban on kratom, like every kratom product, both the natural, the synthetic, all of it, banned. North Dakota, from what I understand, placed that temporary ban on pending the special legislative session. Massachusetts, on the 13th of August, a week or so ago, put a ban on all of it, temporary ban, I should say. And I believe that most of these states are acting in response to what the federal government is also doing. In July, the DEA released a statement that so for the federal government, it's not all of kratom. It's regulating 7-OH in particular amounts. They don't want it to be more than 1 milligram in any package, or 0.05% of the dry weight. Then the second thing they are proposing to put a ban on, which probably has taken effect now, is there are 7 analogs of kratom that they have particularly, said they want to put a ban. So I believe it should have kicked in. It should last for 2 years. It's temporary ban until Congress maybe approves it. So I believe we're going to see a nationwide clampdown.
So if you were in front of my legislative committee, I would look at you not knowing a thing about kratom and look at you and say, should we ban it as North Dakota? Should we vote to ban it?
Being a physician, being a public health expert, my simple answer will be yes. I know that would not sit well with a lot of people, but what I would say is that this is a country where we have people would not drink until they're 21, like alcohol. And we have a substance that can hit 5 receptors sitting in gas station shelves. And I don't know who's checking, but I'm very afraid that many people did not even know what this is. You just hear, oh, it boosts energy. Oh, it kills pain. Oh, simple answer, I think, to protect our children. Yes.
Well, if I were in one of those chairs, you'd just have my vote. I mean, you did a great job of explaining why. The big question is, and I'm not sure that this is your area of expertise, is how you'd police it. How you would go about making sure that, in fact, it was in a position, as you just described, which is illegal. And so I don't know how you do that, other than you can take it off the shelves.
Yes, that is a very astute observation, because as with most substances that become, illegal, the people who promote or, supply these things find ways to skirt it. And I feel like in everything I have seen, state governments, federal governments, I have not seen anybody talk about the online sales. Currently, it's only 25% of, most of the kratom products that are online. But I believe that what we'll see is that you close down 75% in the retail stores, they will shift the business online. And I'm yet to see anybody say anything about that. I've had kids who buy, illicit benzodiazepines, like actually medication that have currently accepted medical use that are scheduled. You order it online. The dark web is thriving. These things go in the USPS, post offices. I feel like it's going to be very hard to enforce. It might sound nice that it's banned, but what about online?
Yeah. Dr. Gbujie, thank you. Thank you for giving us your time. And believe me, I would beg of you to go in front of that legislative assembly. Thank you for coming in.
Thank you so much for having me.